victory note. I'm going to turn it over to you.
Well, thanks, Robin. So, we've had a week, and it's a week that a lot of us knew was coming, right? We watched during 4 years of the previous administration. We watched Mitch McConnell change the Supreme Court. And then on Wednesday, the U.S. Supreme Court heard oral arguments for Dobbs versus Jackson's Women's Health, the case that seems more likely than ever to overturn Roe. And we know that could lead to millions of people, particularly low-income people of color, being forced to be pregnant. In a particularly proud moment for me on Wednesday, Justice Sotomayor asked, "So when you say this is the only right that takes away from the state the ability to protect a life, that's a religious view, isn't it? Because it assumes that a fetus is a life at when? When do you suggest we begin that life?" End quote. Justice Sotomayor was speaking to the duty of the court to rule on behalf of all Americans, not just those who have a certain set of beliefs. And we'll see what happens. We won't know till June the outcome of that case, but it's certainly the biggest case in abortion rights in decades. And it has the potential to change the landscape, both in Utah and across the country. And that's really what we're going to be talking about today. So, there were some tougher moments too. Sotomayor did a great job. We also heard people talking about pregnancies, particularly Amy Coney Barrett talking about pregnancy and abandoning newborns at the safe haven rule, things that were frightening. And a brutal reminder that we really don't fully own our own bodies, and we need to double down on the fight for freedom. We know that from this moment on, our rights can be chipped away and have been chipped away. And Roe was never really enough to get abortion access for everyone who needs it in our country. Here in Utah, we have just 3 health centers that provide abortion and 1 that provides second trimester abortion. And we don't have coverage for people. Military people aren't covered. Most people aren't covered in Utah for abortion, except in cases of rape, incest, lethal fetal anomaly, or threat to maternal life. So what do we do at this moment? It's a moment where I think we really have to lean in to what it would look like to apply a human rights lens, to work for abortion justice. Many of you were at our rally in October, where you heard us use language that really incorporated a human rights approach, and speakers who spoke to many aspects of why abortion access is so critical. We have to lean in to thinking about racism, economic insecurity, immigration status, and how they impact access to abortion care. So a few things that we're working on is changing our language, which we'd be more than happy to talk to all of you about. And we have been talking to policymakers about, and we're lucky to have policymakers who do support access to abortion. But to talk about abortions and to talk about access to birth control, decision-making around pregnancy, including miscarriage, and sex education, and how this is essential to our lives. So one of the strategies we've been implementing to expand our advocacy work is to encourage our supporters to talk about it. We've done workshops on abortion storytelling, and we've partnered with some local storytellers. I really want to kick this off with highlighting a local abortion storyteller who many of you may know. She and several other people have brought their stories to individual meetings with Republican legislators over the past 2 years, and we're incredibly grateful that that work is happening. And we're committing to do our part by continuing to hold storyteller workshops for folks who want to attend. So without further ado, I'm going to start out by introducing Elaine. Elaine Jarvik is a former newspaper reporter and currently a freelance writer and playwright. She does not see herself as an activist by nature, but believes it's important that women speak up. And with that, if you want to spotlight Elaine, welcome.
Thank you. This makes me extremely nervous, but I'm going to do my best. There are many different stories that women can tell, and my story it's going to be short, but it began in 1977, about 2 months after I gave birth to my daughter, Kate. And I strange, jittery, both jittery and exhausted, and I'm so exhausted, like even turning the steering wheel in my car made me want to weep. but I was too jittery to sleep. I was diagnosed with an autoimmune disease that apparently my body's immune system had been so vigilant in protecting me from the foreign cells of the placenta that during childbirth, that those attacked the healthy cells of my thyroid. Eventually, I was treated and I guess cured. 2 years after that, with a little failure of a birth control method, I was pregnant again. And I went to my doctor and was sitting on the examining table, and he told me that think about this carefully, because getting pregnant again and going through childbirth again could set off a chain reaction in my body, and my chronically hyperallergic to a more devastating disease such as lupus or MS. So I was about 6 weeks pregnant, and I was faced with a painful choice. I could try to stay healthy for the 2 children that I already have. I hope you can hear me okay. It says my internet is unstable, so I hope you can hear me. So the more cautious and I believe more loving path to try to stay healthy for the 2 children I already had. And I guess 44 years later, I still believe I made the right choice. I was able to at a hospital. This was, I guess it was 1979, so not that many years after Roe v. Wade. I was at a hospital attended by a doctor and nurses who did not shame me and who did not feel was more valid than my belief system. And I think all women deserve that same. That's my story. Thank you for letting me tell it. I've told it to some legislators. I don't know if it made a difference, but thank you.
Well, thank you, Elaine. And you inspire us to speak up with your courage of sharing your story. And, you know, we all know someone or love someone who's had an abortion. And it's fascinating and also disturbing how few stories we know, even though they're in our lives. And so again, you know, when we tell stories, we can start to chip away at some of the stigma that's been created around abortion by other people, not ourselves, who make these decisions and support people who make these decisions for their health. Also, just loved hearing that a story that was about, you know, a complicated pregnancy and a person's own health, right? Which aren't always the stories we hear. So there's so many stories, and that's what's terrific about getting involved in this work. It's an important part of our movement. Well, now that you've heard from Elaine, I think that we can introduce our keynote speaker. And then following our keynote, we will have an opportunity to have a Q&A both for Jacqueline Ayers, who is our VP, our Senior VP of Policy, Campaigns, and Advocacy at Planned Parenthood Federation of America. And then we can speak more about local work, the work that we share with Women's Democratic Club, and also calls to action, because I'm sure people are feeling after this week like they want to do something. They want to know what we can do in Utah to protect and preserve access. So with that, I think Jacqueline has joined the call. And I should say, I'm so grateful that she made time out of what has to have been a very busy week today to join us here in Utah. So thank you, Jacqueline. Jack, I'm going to tell you a little bit about her, and then we will spotlight her to do her presentation. Jacqueline is PPFA's, as I said, Senior Vice President for Policy, Campaigns, and Advocacy. She's responsible for developing and executing the national strategy and management of the legislative policy, organizing electoral and policy-oriented litigation work. She brings decades of experience developing strategies to advance the Federation's legislative affairs, global advocacy, and federal and state policy teams in order to expand laws and policies that increase access to healthcare for all. Prior to joining PPFA for the second time in her career, she served as the legislative director for the National Urban League, was a legislative aide in the U.S. House of Representatives, covering health, education, and judiciary issues. She began her career as the associate legislative director for the ACLU of Indiana. So she has a lot of experience in this movement. She's a dynamic and brilliant leader. And with that, I'm going to turn it over to Jacqueline.
Thank you so much, Annabelle. Thank you for the Women's Democratic Club of Utah, the Planned Parenthood Action Council of Utah. I'm really appreciative that you all are having me on your Saturday morning, my afternoon. Really happy to be with you virtually, but next time maybe you guys could invite me out to Utah. I've never been, so it's on my list to make it out to you. I really do hope that all of you all are well in this moment. You are right, it has been a really hard week, but this is also never more important of a time, right, for us to all really be focused on what's at stake and to have this conversation about agency, access, and the future of abortion. Your advocacy, your voices are so needed. Thank you so much for your storytelling. It makes everybody, and thank you to elected officials who have been doing storytelling, really understand the impact that this has on people's lived experiences. As you just heard, I've been doing advocacy on behalf of Planned Parenthood nearly 20 years in my role on Capitol Hill, my role at ACLU, and then obviously at the National Office for Planned Parenthood. And I have always believed that it is not the vocal minority who we hear the most from, but really our silent majority who really need to make sure that their lived experiences are heard by politicians. So now this is really a key moment. It's time for our quiet majority to get loud. That's why you are engaged in the way that you are. And most importantly, what I would say is that we're going to talk today about everything that's going on and give a national landscape. But as hard as this moment is, thinking about oral arguments this week, Planned Parenthood is exactly the right organization for this time and this moment. You are exactly the right advocates and supporters and allies for this moment. It's daunting listening to that oral argument this week, thinking about the restrictions that you all have there in the state of Utah, but we are really built for this. Our movement is built for this. And so I want to talk to you this week, obviously, about the oral arguments in Mississippi, what is continuing, the tragic state of play of what is happening in the state of Texas, and a little bit about 2022, how we got here and 2022. But remember, as I talk about this thing, it will sound like a lot of bad. And so I always tell folks that when we are delivering the state of play from the national landscape, really important to remember we are built for this moment. So I guess I do want to start with Wednesday. The Wednesday oral arguments really were hard to listen to, but should not be surprising. We and advocates like yourselves who've been doing this for so long, we've been sounding the alarm for years and years, especially during the previous administration when we saw President Trump and Senator McConnell breaking rules to push 3 justices who were known to be hostile to the courts to get them on the court. We knew where this was going. And in turn, we knew that states were going to do exactly what they have done, which is to push state laws forward to this conservative court in order to have a direct challenge to Roe. So now coming out of Wednesday, and I've spent a lot of time talking to our litigators and the litigators for the Center for Reproductive Health and Rights, the folks at the Department of Justice. And we know that it appears that there is a majority of the court willing to turn back the clock on 50 years of precedent. What they would be doing is unraveling really what are core principles of Roe in order to allow Mississippi's 15-week abortion ban to stand. There's a majority who it appears that what they talked about in that oral argument is that states would be allowed to ban abortion prior to viability. And of course, we don't know how the court is going to rule. But the fact is that whether they end up saying Roe v. Wade is the law of the land, but yes, Mississippi's law can stand, that's one possible outcome. Whether or not they end up doing exactly what the state of Mississippi asked them to do, which is to completely gut and get rid of Roe v. Wade altogether, simply the fact that this case was even taken should be shocking to people in this moment, because again, after 50 years of precedent, it is really flies in the legitimacy of the court, flies in the face of legitimacy of this court as to why we are even at this moment. Justice Sonia Sotomayor said on Wednesday, if the court were to take away this fundamental right that generations have relied on, how will the court be able to survive this stench? And we know that because of the current state of play of access, Roe v. Wade really is kind of the floor, right? Is that for many people, because of these state restrictions, Roe v. Wade and access to abortion has already been out of reach. But if this Mississippi law is allowed to stand, it really will fly in the face of justice. And it will create a United States where access to your constitutional right will literally depend on your zip code. They are seeking, the state of Mississippi in this case is seeking a place where the states and politicians get to decide if you're free or not, if you have fundamental liberties and bodily autonomy. It's truly a very alarming moment, but I do want to note that we are built for this as advocates. And it is important that as you're talking about this, and I've been talking to reporters this week who have asked, what if I'm a person who doesn't plan on getting an abortion? I don't need an abortion. Abortion doesn't impact my life. Abortion doesn't seem like it is related to how I live. So I thank you to the storytellers and whoever just said, we all know someone, we all love someone who has had an abortion. But if you're out talking to people and advocates and you're trying to talk to other grassroots supporters about why they should care, we really only have to look to what Justice Sotomayor and Kagan said this week in the oral arguments, which is abortion is not the only right at stake. Unraveling the right would lead to questioning other rights and liberties, such as who we can marry, how we form our families, access to contraception. The states' rights arguments that are being made are the same arguments we have to remember that literally started the Civil War and had the impact that it did on people of color. We saw Justice Amy Coney Barrett make arguments this week about safe havens, contraception being widely available, as if to say those are reasons why someone should be forced into a pregnancy. The oral arguments, in a word, were offensive and grim. Especially when we're thinking about states like Mississippi, where they have an expanded Medicaid. Access to contraception is not easy, particularly for low-income people. Maternal health rates are dismal, particularly for Black and Brown people in the state of Mississippi. Mississippi is a state that actually kicked Planned Parenthood out of its Medicaid program. So this idea that you could continue your pregnancy and you'd get access to healthcare, it's just not true. And again, just simply offensive. And in fact, Justice Sotomayor reminded the Mississippi AG that 19% of women in the state of Mississippi actually are uninsured. So there's already a lack of equity, and this case would just allow people's bodily autonomy and access to their fundamental liberties to be undermined. So, we're at this moment where we have generations of people who have relied on Roe, who have organized their lives. Sure, if we were to hear other people's stories today on this call, you would hear about people who've been able to make decisions about their bodily, about their choices, about their careers, college, future, where they're going to live, how they and when they decide to build their families, knowing that if they had experienced an unintended pregnancy, there would be the right to abortion. And unfortunately, this week, it seems like many of the justices just did not recognize or care about the progress that women have made in the last 50 years because of Roe v. Wade. And as we think about Mississippi, obviously what we didn't hear this week in the oral arguments is the backdrop of what has been happening even before December 1st, which is Texas. We know that this week we reached the 3-month mark. 3 months since abortion has been banned, after 6 weeks has been banned. Texas is a state that normally would see 55,000 abortion patients in a year. And in 3 months, patients, unfortunately, and our Planned Parenthood affiliates in Texas, as well as in the surrounding states, are really scared. They're confused. This law is doing exactly what it was intended to do, is to create confusion and misinformation. We've seen this ripple effect right now across the country. Hundreds of people have traveled out of state going as far as to Illinois, California, New York. In fact, the Planned Parenthoods surrounding the state of Texas had, in this month of September, reported 1,082% increase in seeing Texas patients. So patients with Texas zip codes going to Oklahoma and New Mexico, and that's just for the month of September, over 1,000% increase. And remember, these are just the people who can travel. There are so many people who can't because of immigration, cost, other barriers, can't get out of the state and are being forced into pregnancy. And we know that last month there was also oral arguments before the Supreme Court. So those patients did get their day in court last month. And in that oral argument, lawyers for Texas and for the United States made the case for why the Texas Senate Bill 8 should be blocked and why a 6-week ban is unconstitutional. And remember, Texas is a state that passed not just an abortion ban, but they added a unprecedented enforcement scheme whereby any individual could sue someone who has found to be aiding and abetting a person who gets an abortion. That scheme is mostly what the justices focused on, and whether or not there is the ability for the court to reconsider that. In that oral argument last month, we heard Justice Elena Kagan say, we have to remember, this shouldn't be up for debate. A right is a right. So in that case, we can't predict what will happen. We are waiting for any moment and any time the justices could hand down a case for an opinion for Texas. In Mississippi, we are predicting that we'll hear that decision come down closer to June or July of 2022. But as we talk about Mississippi and we talk about Texas, we have to pull out a little bit, right? That all eyes are on these two states because these are where the Supreme Court has been focused the last couple of months. But we have to remember that 2021, this year actually was the worst year for abortion restrictions than ever before. We know that if in fact these two cases don't go our way, that Roe could be rendered meaningless. And in fact, we know that 26 states, and we'll talk about that in a little bit, 26 states are poised to move in the direction of banning abortion. That would impact 36 million people. So this is a fight that is going to be state by state, city by city. No one is not going to be needed in this fight. We've never really been as close as we are right now to losing a fundamental constitutional right. And I think as advocates, as people who care about these issues, as people who want to bring others to this movement, as people who want to donate, if you want to volunteer, any way in which you get involved right now, you have to be prepared to answer this one question. Where will you be the moment that Roe fell? And what will you have done? That's why I want to remind us where I started, which is we're built for this moment. We are truly, as a movement, built for this moment. Again, I mentioned there's state restrictions that happen. So I want to talk a little bit about where are we going since 2021 was so bad. What does that mean 2022 is going to look like? We saw, as I mentioned, 2021, the most restrictions introduced in state legislatures since 1973 when Roe v. Wade was passed, over 600 bills introduced. And we know that if these laws are allowed to stand, that far too many people, disproportionately people of color, people who live in rural communities, people who are living with low incomes, that unfortunately abortion is already inaccessible, but this onslaught of draconian, medically unnecessary state restrictions on top of a increasing shortage of abortion providers is going to further exacerbate this system. So to break down those 26 states that we said who might move in that direction, you know this well as being in Utah, there are 12 states that have, that state governments have what is called trigger laws, whereby if the Supreme Court were to overturn Roe v. Wade, they have already a law on the books. So Arkansas, Idaho, Kentucky, Louisiana, Mississippi, Missouri, North Dakota, Oklahoma, South Dakota, Tennessee, Texas, and you all know well, in Utah, you have these trigger laws. After we count those 12 states, there are another 9 states that have what are called pre-Roe abortion bans. that could be enforced if Roe falls. So that means that before 1973, these are states that already had on their books a ban on abortion. That's Alabama, Arkansas, Arizona, Michigan, Mississippi, Oklahoma, Texas, Wisconsin, and West Virginia. Most of those post-Roe abortion bans have been blocked by the courts. Because of Roe, we saw those be blocked. Unfortunately, if the Supreme Court allows Mississippi's ban to stand, those 9 states could swiftly take effect. And so even when we look at states where there are constitutional protections, there's another handful of states where they have constitutional protections, Florida, Iowa, Montana, where abortion access is still at risk. And then there are states where there are supportive governors, but not supportive state legislatures. Michigan and Wisconsin are good examples. Where because of hostile legislators, we could see and the shift of state courts and judicial makeups, we could see Roe being at risk. So that's how you can see how very quickly in 2022, it is not going to be a question of if Roe will fall in states. It is going to be a question of when, if we do not see the Mississippi case go our way. And certainly, you know, for you in Utah, what that means is a very swift impact on patient access and services. And I should note that, as you know well, in Utah, it's not just about banning the procedure. A lot of states, and Utah is included in this, have already imposed restrictions, things like unnecessary medical waiting periods. Some states, and I know you all have the medical waiting period, bias counseling, some states have forced ultrasounds. All of these types of restrictions currently are creating barriers for people to get access. And on top of that, we're going to be dropping these additional bans. We've already seen that states, governors have said they will wait and see what the court does, but we've heard from Florida, Arkansas, and Missouri that they will quickly file Texas-like copycat bills. So they're not even going to do what Mississippi did with their 15-week ban. Mississippi also passed a 6-week ban, but they're going to go immediately to the Texas-style 6-week ban. They've already said that they would similarly create this vigilante enforcement scheme whereby any individual could sue a person who is helping someone get an abortion. And so these laws would really only are for the purpose of harassment, creating further violence, intimidation of undocumented people that would have the impacts of further targeting Black, Latino, Indigenous communities. We anticipate that we actually are going to be in this moment. We're going to know a lot more in January of 2022, because we're going to start to see state legislatures come back into session and begin to file. So what do we know about what the electorate is feeling and what our people, actual voters, not just the elected officials who are passing these laws? We recently did a poll with the organization called Emily's List and American Bridge. And that showed that when we look at the turnout targets, target voters and swing voters, this issue, ever since Texas put forward their 6-week ban, people are really highly motivated. They're very concerned about access to abortion. It's really more than I've ever seen before when I've been reading these polls. And still, as motivated and highly aware people are, only 33% of people in our poll believe that Roe will be overturned. But come 2022, this reality is going to hit them in the face, right? And we know that just about 6 months from the next election, they're going to have to experience this in real time when the Supreme Court hands down that decision. So our job as advocates, as supporters, as allies at Planned Parenthood is to be able to increase that believability number. We need to make that believability number of what is about to happen to Roe from 33% to 80%, right? We have to make this really an issue that connects for champions and work against opponents. When we look at the 2022 elections, Planned Parenthood Action Fund will really be focused on governors' races in Michigan, Wisconsin, Minnesota, and Nevada. because we have to continue pro-reproductive healthcare leadership. We have pro-reproductive healthcare governors right now. Those governors can serve as a backstop to prevent some of those trigger laws, those pre-Roe bans from actually going into effect. And we need those legislators who are willing to override, right? Override those books, bad laws that have been on the books. And we know that these issues are connected and related. And I'm so glad that folks are here from the Women's Democratic Club of Utah, because these issues are so interrelated. The states that we just talked about that are hoping to ban abortion, they're also the same ones that are attacking the right to vote. They're attacking the health and safety of trans and non-binary siblings and what children can and can't learn in schools. We know that all of these state legislatures are pushing forward these attacks because they are thinking about who to harm. It's going to be Black, Latinx folks, low-income people, LGBTQ people, youth, our next generation. Our opponents really understand how these issues intersect. And so that's why we have to make sure that we are talking about these freedoms as really connected. An attack on one of these freedoms is an attack on all of these freedoms. And again, we have to remember that our movement is built for this. 80% of Americans want abortion to be legal. There's actually not one of these states that we just talked about, no state in the union, frankly, where banning abortion is a popular idea. And, you know, we have to keep reminding ourselves, we didn't get here overnight, but we do have, and they have been at it at decades. Undermining Roe v. Wade has been their central focus for many decades. But we have to move with the will of the people, move the will of the people to being vocal. But we have seen decades of changes to rules, gerrymandering, court packing, power grabs that have happened to our opposition, and it's making it harder and harder for that quiet majority to actually be heard. So in a way, we're kind of living under the tyranny of the minority, but we need to be relentless and strategic as our opponents. We have been talking about this, those of us like myself, we've been doing this for 20 years. Our president and CEO, Alexis McGill Johnson, frequently talks about the pendulum of the past 20 years. This has been a moment that we have been building for a long time, as we've seen all of these things like rule changes, redistricting, gerrymandering, it make it so that unfortunately, the majority's voices are no longer reflected, that the people elected are not reflecting the voice of their constituencies. And 2020 is what we've been talking about. 2020 is kind of being halftime, but now as we head into 2022, we've got to get back out there on the field. People are really waking up to this reality. People really, what they did not believe possible, they're now, particularly now after the oral arguments, they are enraged. And if there's anything that is somewhat of a silver lining, maybe our only silver lining is that everybody is now in it. People are ready to fight for our fundamental rights, and they absolutely know that we're built for this moment. This is not just going to be about things like, the trans bathrooms issues, transvaginal ultrasounds, admitting privileges. I think in the past in this fight, we have been talking about maybe issues that people didn't always understand. And again, our opposition was intentional about that, right? They knew that by making us fight about the size of hallways or waiting periods, that we weren't connecting with people. But now in this moment, this is really about all of our freedoms. All of our freedoms are being taken away. That's why we need to keep the conversation going. We have to talk to everybody. Reminding everyone, 1 in 4 women in this country have had an abortion. We all love someone who has had an abortion. People are really counting on us in this moment. And this is happening on our watch, that Roe would fall on our watch. Our job is to really channel what we are seeing in rage into policy and into power. And I know that the Planned Parenthood of Utah's Action Council, Planned Parenthood Action Fund, we are positioned for this moment. We are the trusted messenger. People do believe and trust, and activists and supporters want to hear from Planned Parenthood. And the currency of healthcare, we know, is not just providing healthcare. We are a trusted messenger and a trusted healthcare provider. So I really want to get into discussion and conversation. So I just would say as a close, this is absolutely not the moment we would have chosen for ourselves. This was a very hard week. It was grim and a gut punch is what I heard one of the fellow advocates say. Not the moment we have chosen, but we are absolutely ready. We can take some strength from those two women lawyers who were arguing in front of the Supreme Court, Julie Rickleman for the Center for Reproductive Rights and the Solicitor General, only the second US Solicitor General who is female to argue before the Supreme Court. And we know that we can take this movement the direction that we need to. We're the movement for this time. Really, it is because all of you remember, and thank you to our storytellers, we are the ones who built this movement. I want to thank everybody for your support and thank you for being in it because we are built for this and we are ready.
Thank you, Jacqueline. Round of applause, virtual or again, just showing up after this week of gut punches and such is terrific. We're happy you're here. I wanted to also acknowledge someone who's built this movement in Utah. Carrie Galloway, our CEO, is on the call. Thank you for being on and for your tireless everything, Carrie. She is the trusted messenger. And Katrina Barker, who's on, our Director of Communications and Marketing, Candida Duran Taveras, who's our Director of Community Engagement. We have a great team at Planned Parenthood Utah to do this work, and I'm very lucky to have them as colleagues. I want to turn it over to Chelsea, who, Jacqueline, you're getting a lot of love in the chat. Someone wants to be you when they grow up. So that's pretty good after you said what a hard moment we're in. Okay, turning it over to Chelsea Kilpack, who's going to do a Q&A with all of you. There's already some questions in the chat, and then we'll go back to Utah. Does that sound like a plan? I think we want to get going on the national first. Okay, Chelsea.
Yeah, I think that's great. Thank you, Annabelle and Jacqueline. Thank you so much. Please drop your questions in the chat. With over 60 of us, I don't think it'll be best if people start chiming in. The first question that we have is from Wendy Davis, the head of our candidate support committee. She asked, what are the constitutional experts actually saying today? What has changed in the constitutional arguments that were advanced 50 years ago when Roe was first argued?
Yeah, thank you for this question. A lot of court watchers and lawyers have been talking about this last couple of days. I really think that the politicization of the court and the lack of legitimacy of the court is bringing into question how much people will trust and believe in the court, right? And I think we already have seen the Congress and the administrations as they go back and forth. People don't really trust their elected officials. The court kind of has been serving as a backstop, particularly for our movement. As we've seen restriction after restriction pass, what we were able to do is go to the courts. Now we have really lost that moment. And we can no longer believe that the courts are the backstop. They just will not be that anymore. And I think as people lose trust in the court, the legitimacy of the court is going to come into question. We have to remember this term, they're going to hear a decision, make decisions both on abortion and gun rights. And it will be extremely political. There's no way right now for the court not to be seen as political, but when those two, by the end of June, we'll have both of those decisions. It will be a direct reflection of the previous administration's policy choices and the people that were put on the court. And ultimately, I think there's a lot of questions. This is why you hear a lot of constitutional scholars and court watchers who are talking now about things like it's time to expand the court. While Planned Parenthood Action Fund has not taken a position on that issue, it is absolutely something that we think it's right to question and start to look into and ask that question. There's no magic number to 9. It didn't used to be 9 in the 1800s. It doesn't have to be 9 now. And so I do think that this is going to be a moment that all of our issues will be linked to broader democracy reform. The Planned Parenthood Action Fund at the national office, we have taken positions on democracy reform, including things like changes to Senate rules, including filibuster reform that would change and give more power to the legislature so that the Senate could move legislation with less than 60 votes. So I think that it is an interesting and historic moment. One thing that I heard a reporter say this week is, as you were listening, if you watch any of the coverage or you heard anything from the oral arguments on Wednesday, you knew that we were sitting and watching a moment of history. no doubt about it, this was a historic moment. First, that we got to hear it, right? If you remember, we normally don't get to hear the justices live because of the pandemic. We're hearing them live for the first time. But two, because of the way that oral argument went and what everyone anticipates the decision to be, it is very clear that respect for precedent is flown out the window now.
Agreed. And yes, we need to end the filibuster. Cannot say that enough times in a day, I don't think. Speaking of congressional action, can you speak to the two bills that we need to get passed, the Women's Health Protection Act and the EACH Act? I believe Annabelle mentioned are the names in the chat.
Yeah, thank you so much. The Women's Health Protection Act is a legislation that's been around for a few years, introduced on the House side by California member Judy Chu, and on the Senate side by Connecticut member Richard Blumenthal. And what it would say is basically what we already have come accustomed to in the similar way that the Voting Rights Act has said, if you are a state that has a long history of preventing someone from participating in their constitutional right, you would have to show, the state would have to show that they reached a certain burden, that it doesn't undo a burden by those restrictions. So the Women's Health Protection Act also lists out various restrictions that would not be held as constitutional. So it would create that balancing test where a state could not just throw on a new restriction on the book. There would be a federal check and balance of that. And the second one, the EACH Act, that is a bill that ultimately seeks to rid the federal budget of the Hyde Amendment of 40+ year discriminatory restriction on the use of federal dollars for abortion. In the 1970s, when that passed, it just applied to Medicaid. If you're a low-income person who relies on Medicaid for your health care, you cannot get abortion. Unfortunately, it now applies to federal employees and anybody who gets their health care from the government in any form. So whether you're incarcerated, whether you're low income, whether you're a federal employee, if you are, like I am, a resident of the District of Columbia. So the Hyde Amendment has now expanded to reach so many more populations. The EACH Act says that we would get rid of all of those restrictions on federal funding for abortion.
Fantastic, thank you. We have a question in the chat about tying the loss of Roe to the loss of other future rights, like you've talked about. So I guess I'm gonna make up a larger question here, is how do we talk to members of our community? You got to that a little bit in the beginning. How do we make them understand the severity of the erosion of rights with Roe and everything else?
Yeah, what I've been saying to folks is, look, we know Roe is 50 years old. The right to marry, the right to be intimate in the way that you want to, the Lawrence v. Texas case, your rights to have contraception of choice, the Griswold case, those are much more younger than Roe, right? And so if Roe can fall, there's no reason why cases that were founded similarly on the fundamental liberties recognized by the 14th Amendment, all of these cases have the same holding. And I think the way to get people to understand that is, particularly given how conservative this current court is, if you care about climate change, if your issue is the environment, voting rights, civil rights, immigration, that links us right as a broader progressive community, because all of these rights are now to be a threat. It's just a question of when conservative state legislators push a case forward that it gets to this conservative court. And again, this term, we're already going to see both rulings on abortion and guns, but there are many, many more in the pipeline about all the issues that people in your life care about. And I think that's the way to convince people why they got to jump into the fight now.
Great. We're getting a lot of questions about medical abortion, the abortion pill in the comments here. Questions about, with COVID, telehealth became really popular. Is that going to be a workaround, are we thinking, if Roe is overturned? Is there something we should do specifically on a national level to look at protecting medication abortions?
Yeah, it's a really good question. And I invite, obviously, the PPAU staff, you guys can jump in here for Utah specific things. But one of the things that we have advocated before the Biden administration came into office was the removal of what is called REMS restrictions. What it basically says is the medication abortion is regulated differently by the FDA than any other type of medication. It has to be prescribed to a doctor, and it has to be given in person. That in-person requirement in the middle of a pandemic is ridiculous. It should not stand. And we actually saw some states at the beginning of the pandemic relax some of these restrictions. So what we have said to the Biden administration is that it is time to lift the in-person requirement on medication abortion, which certainly would help to increase access. Now, unfortunately, there are also several states in anticipation of the federal government doing that have put forward restrictions on the ability to use the mail. So mailing, you know, just like, I don't know about you, but my parents certainly do get medication. They get medication through the mail. And many states have put restrictions, and you guys will help me out here. I'm not sure if Utah, if you have a telehealth restriction yet. No.
We do not.
Great. So if the Biden administration takes this action that we have been requesting, that would go a long way in Utah to make sure people can get access to medication abortions via telehealth.
Fantastic. Jacqueline, thank you so much for taking the time today. Give her another round of applause, virtual, or unmute yourselves. If we didn't get a chance to get to your questions, drop them in the chat. That's being recorded, and we'll make sure that we get you some answers. I'm going to turn it back over to Annabelle now to talk about, we've got the national picture. We're riled up by everything Jacqueline's been saying. Now we're going to drill down and talk local, what we can do.
Okay, terrific. Jacqueline, it's awesome listening to you. And so let's talk about Utah. I saw so many important things in the chat from so many of you. And I just want to acknowledge that. So we do have a trigger ban bill, as Jacqueline mentioned. It was passed in 2020. Many of you spoke up with us about it, SB 174 by Senator McKay. And so we are one of those 26 states that are hanging in the balance. The combination, initially when SB 8 came out, right, there was concern that, is Utah going to see a kind of copycat? Lots of states have had that concern. We're certainly paying close attention, but one of the interesting things about working with the Utah legislature is until they have to reveal the contents of anti-abortion legislation, they're usually not revealed. From the scuttlebutt that we hear, the overarching feedback is that the legislature feels like it's done a lot with this trigger ban, and there doesn't seem to be appetite for SB 8 type legislation, but we are certainly paying attention. And so that was our initial first big concern. I think I need to back up because I saw people in the chat talking, like Holly Mullen and others, about they're coming after contraception next. And I think this is part of the whole Utah conversation, right? So here in Utah, I do just want to give people a little bit of a traveling back. For 30 years or more, we stewarded what's called the Title 10 funding, the National Family Planning Program. And during year 4 of the Trump administration, we were forced to exit the program because we wouldn't comply, just like all Planned Parenthoods wouldn't comply with what was essentially a domestic gag rule, telling providers, people using the Title 10 funds, that they couldn't say the word abortion. And so and they couldn't provide abortion. And so we stepped away, even though we were very competent at administering this program well, being an abortion provider, and passed every single bells and whistles, audit for the entire 30 years. So what that means is that Utah is down. There's no public funding for contraception in Utah right now. The state has done nothing to invest public resources in it. An example, Senator Kitchen for 2 years has run a bill to try to expand Medicaid funding to cover contraception. The legislature won't pass that, right? We at Planned Parenthood, thanks to this village and our village in Utah, have had to raise an additional $2 million to subsidize the healthcare that people just couldn't afford. And we were pretty aware that we don't know that that's forever, right? We were responding to a situation. And we are currently applying to the new Title 10 fund, which the Biden administration has reissued with better regulations so that Planned Parenthoods nationally, including in Utah, can can be a candidate to receive the funding. So I think a part of the conversation in Utah is really to highlight that the state doesn't support people with family planning needs. As we know, the state doesn't do a great job supporting people with children who are here, right? So they're not doing a good job with foster care, with the education system that works for all students. They're not doing a good job with economic support for families living in poverty. We saw lots of articles about that this week. And so really thinking this conversation is broader, and the state is not doing its part. They're certainly not doing their part with sex education. So when we think of it together, that's partly what we think about at Planned Parenthood Utah, and we want to convey to you. We also know that working across movements, I saw somebody put something in the chat about Black Lives Matter and where's the human rights approach. Working across movements is really how we're going to build power, not being isolated. So we know the opposition is more organized than ever. We know they're showing up at school board meetings. We know they're showing up at city councils and county commissions, and we have to be the doers too, right? So I was kind of blown away by Jacqueline's starting question, where will you be when Roe falls? And I think it just prompts us all, right, to step up our game and do what we know we can do when others who don't share our beliefs are doing. And so I think we need to just remember that this work, if we're going to really liberate abortion, make abortion more accessible to all, it's multiracial, it's multi-faith. We have to think about diversity of geography. We have to think about ability, gender spectrum. We have to think about sexual orientation. We have to think about immigration status, as Jacqueline mentioned, and income level. I mean, I want to say my rights were, I was contemplating my reproductive rights being restricted for the first time in my reproductive lifespan. I'm someone who can drive to, Grand Junction or to Nevada or to California if I needed to, but not everybody's in that situation. And when we think cross movement, it really centers the inequities, right? And it really has us thinking about who we need to advocate for. So again, it's going to take a village to do this work, and you are all part of the village, and we thank you for being part. We know Utah is the worst state for women and continually gets ranked that. How is implementing the trigger ban bill going to help that? It's not. When we put it in the context of these bigger issues like paid leave, I see Senator Reeby is talking about contraception for things for economic gains for women. Absolutely. Abortion too. We know from something called the Turnaway study, hopefully Chelsea can put that link in the chat, that people who have access to abortion rather than people who got turned away at a clinic, this is a very interesting study, they compared these two groups of people. It's a research out of the University of California at San Francisco. And they found that people have better, looking at the two groups, the people who actually were able to access the abortion have better mental health outcomes, which we know mental health is important to our legislature. They have better economic outcomes. Their children had better well-being. We know that it impacts more than just, one pregnancy decision, that it's these people who are getting abortion are often parents. Nationally, they're more than half are parents. And they're making decisions for sometimes more than one person. Thanks, Claire. Claire says everyone should read the Turnaway study. I agree. There's actually a book for the people like us, lay people, that's pretty terrific. We know that part of the strategy, in Utah, we've been able to remove barriers by doing things like having a telemedicine consent option for that 72-hour, to trigger that 72-hour waiting period. We've done what we can to use telemedicine at our Logan Health Center to provide abortion. But we know that once that trigger ban comes into play, we may be thinking and talking more about miscarriage management so that we can help people who are dealing with all kinds of pregnancy situations, right? We may be having to think about Plan C, right? A lot of you have probably seen some talk about Plan C or pills by mail. These are not Plan B. Plan B is, as I corrected in the chat, kind of after unprotected sex up to 72 hours, or 5 days really, but most effective in 72 hours. People can take a pill and it works like a birth control. Plan C is a medication abortion, and people can get abortion pills by mail too. That is, in Texas, that's not okay. So that's a state by state issue. but we will all need to pay attention to potential further restrictions and to thinking about how we can unrestrict together what we can do to push back against the trigger ban bill that's in place.
Hey, Annabelle.
Yeah.
You mentioned the trigger ban. We've got a question in the chat about that, asking, does it exclude cases of rape and incest?
Yeah, our trigger ban bill has some exceptions. So it does have rape, and it does have, I have to check if it has incest actually. It has rape, and it has some maternal health situations, and it has some lethal fetal anomaly.
Thank you.
Yeah, I mean, it's really thin pickings what it has. And some of the things we need to do is kind of think about where we might be able to expand some of those exceptions to give healthcare providers the ability to implement this policy for starters. I want to say a couple of things. Diana mentioned in the chat that the Utah Medical Association has taken a position, right, where they've said they're not going to oppose any legislation that restricts abortion before 13 weeks. So that's a big deal. So folks who are healthcare providers can speak, can read what the UMA did, but also speak with administrators, kind of have conversations with their colleagues about how they're going to ask their institutions to work toward this. And the Utah Hospital Association, I mean, these are important players when we think about the McCabe bill. Something that we'll be doing is another round of polling. We mentioned that we found a few things in our 2020 polling that we did with the ACLU of Utah, Alliance for Better Utah, and University of Utah. We'll do that again. And we have, it's a nail biter, but we'll be trying to understand a little bit more about what people in Utah think about abortion and abortion restrictions again, and about sex education. So that should give us all some information going into the session. We're doing the abortion storytelling. We've done a little bit of candidate training around how to craft a values statement around abortion. So how to lead with values, because we know that that really helps. And we know that values like agency and autonomy can land well, personal decision-making can land well in our community. I think I'm gonna stop there. I'll end with a couple of things that I think we share with the WDC, which is working to get candidates elected, particularly women, is something that we can do, or people who stand up for women, is something that we can do in Utah to help get that status of women out of dead last. Also, we're going to be doing some canvassing and some door knocking and some issue-focused education. And as we make those plans, we'd love to reach back to the Women's Democratic Club and see if you'd all like to do a little bit of door-to-door outreach with us and get out there in our communities and talk to people. Because we know when we talk to people, they can actually move on this issue. The issue being abortion, that people often just haven't had a real conversation with somebody. So we'll be doing some work with getting effective messaging for Utah targeted communities. And cross-sectorally, I just want to lift up some of the important education equity work that's going on, because we have issues in schools where people are being really badly bullied, and it's very hard to maintain a healthy body image, a healthy sense of someone as a sexual being when their appearance or other factors of their identity are being attacked in school. So I did put it, I do think all of us can work to support the Utah Educational Equity Coalition. And I'm very concerned about where that will go with sex education this session. So I'm so glad Senator Reeby's on, because she's going to be doing a proactive bill that empowers parents, which is very in line with some of the language we're hearing from the opposition about parents' rights. So I said a lot. I think I need to pause, take questions. I need to ask if other Planned Parenthood team members want to add to this of Utah highlights. Let's hear what you're thinking.
In the chat, we just keep seeing over and over, Annabelle, targeted. Like, is there a list that we can all come away with? I don't know, everybody, I like a to-do list. Like, if I'm writing down what's the first thing I should do when I leave this event? Do I need to reach out to the medical board? Is it following the Ed Equity Coalition? Give us a few things, Annabelle.
Sure. A couple of action items. I would say you can talk to your legislator. You can reach out, say hello, make sure you have a relationship with them, and let them know that you do have concerns about healthcare, access to healthcare. We are encouraging people to talk, even just to themselves and the people in their lives, about abortion and about pregnancy decision-making. And so that's another thing people can do. So cheers again to Elaine. We will be having 2 lobby trainings we call the Beehive Academy in January to give people some skills so that they can feel more confident in reaching out to their legislator, developing a relationship. And it looks like one option is we will do a follow-up email with more action items and opportunities for folks to sign up. As a very simple thing, you can sign up to join the Beehive, which is our community of supporters, and become an ambassador. So yes, Holly likes that name. There's a link to sign up to be an ambassador. You'll start getting our emails so that you know what we're up to, what legislation we're following. But again, you're going to see us being cross-sectoral where we can. So we'll be working on the Crown Act, right? We'll be working on eliminating the food tax. We'll be following Representative Lesser's maternal mental health bill, okay? And looking at her mama bus bill, which is about maternal health in Utah. So yes to Tina. I'm really hoping Senator Reby will unmute and speak about her bill. And I'm liking all the chat. So thanks for your participation. Senator Reby, are you able to hop on?
I am. Thanks so much for everybody being here today. I was telling Robin Huff that after this week, I needed to be around like-minded people and realize that there is hope and we need to fight back. It's been really depressing. My bill is I'm working with the State Office of Education. And as I said in the chat, I've actually received support from the higher ed community asking us to run this bill for better access to healthy lifestyles, and or as I like to call it, sex ed. We need to make sure that people understand what it is to be sexually assaulted. There was an article in the paper about a young lady who had been sexually assaulted, and she had no idea she was sexually assaulted. And I also said in the chat, I've shared more stories about my reproductive rights after being elected than I had ever said in my whole entire life. I'd never talked about my miscarriages, my experiences in high school and college. And it's shocking that this is something that we feel as women we shouldn't be sharing because it's uncomfortable. But I really urge you all to share your stories and always talk to it, and always meet those people who say these things with a logical response that says that's not the experience that I've had. Because when we talk to our legislators, it's always this otherworldliness, but it's not. It's us. It's all of our sisters, our mothers, our grandmothers, our aunts, our neighbors. And so we need to have those conversations, and we need to really push back in a gentle way and say, this isn't somebody else. This is me. This is my neighbor. This is my mother. This is my mother-in-law and my grandmother-in-law. So the school board, I would ask that all of you reach out to your school board members locally and say, this is something that you want. You want better sex ed. You need to have it in your schools. I mean, this is something that causes depression. It causes suicidal tendencies. My first intern on the Hill was a gentleman who came out of Harriman, and that was the year they had 12 suicides. And he said to me, he goes, Kathleen, if they had ever talked about what's in this bill instead of just everything else, my life would have been completely different. And so just hearing that from a young man who went to that school and said he never heard anything about having a healthy relationship, being able to walk away from something that's not productive. It's mind-blowing. So my bill is going to be about providing opt-in options. And so instead of saying you have to opt out of it, you're going to have it available and parents can opt their child in. And like I said, I'm working with the State Office of Education. I have higher ed supporting me. And then I also think I'm going to be piggybacking on Representative Moss's bill, and we're going to start to maybe have a more aggressive campaign where we get victims of sexual assault to show up and say, this is what happened because I didn't understand what was happening to me. So I really appreciate the support of Planned Parenthood. When I was a college student and after, I'd always gone to Planned Parenthood, and they are just a tremendous resource in our neighborhoods and our families. Thank you.
Thank you so much. Okay, Annabelle, do you have anything else you want to add before I turn it back over to Robin?
I think I'm going to ask Carrie if she wants to say something, because I think she has thoughts.
Yeah, please.
All right.
Well, I'm just so pleased to have all of these incredible progressive individuals spending a Saturday morning getting riled up because this topic is so important. As Robin said in her introduction to our lives, whether we've passed our reproductive years or not, they're talking about controlling our bodies. And my 60s woman is just pissed. And I want just to thank you all for your support, for the Women's Democratic Club, for partnering with us on a fundraiser, because as Annabelle's pointed out, donor fatigue is happening, and we need that federal money back to continue to subsidize healthcare for the women and families of Utah who can make it to us. And we're always looking about how we can make it to people who haven't made it to us. But I'm going to turn to a commercial here because it's a fundraiser. And as of midnight on Sunday, there's going to be a virtual raffle up to finally culminate 50 years of Planned Parenthood. Some of you may have bought a ticket to our gala. That was in March of 2020, and we had to postpone it. And we've just said uncle, to be honest with you. And we're going to, on the 18th, thank people who have entrusted their hard-earned dollars with Planned Parenthood and call the gala virtually succeeded. And with every good gala is a raffle or a auction. And so the auction will be up in the cyber world on Sunday night, and you can actually shop and donate your money to Planned Parenthood and take home a fun prize. Planned Parenthood is such a worthy cause, and I'm so pleased that you care about the services that we provide to people. And I just wanted to provide you another way to support Planned Parenthood. And thank you all.
Thank you, Carrie. It looks like we're at, there's a lot of chatter in the chat. Representative Lesser, would you like to speak about your legislation?
Sure. As some of you may know, I am an obstetrician gynecologist and served first in the military as an OBGYN physician and then in Utah for the last 30 years. And so I bring that perspective of truly caring for women from many different walks of life. So I'm going to use my background in the legislature to try to streamline access to maternity care in our state and also expand postpartum coverage beyond 60 days. And for anybody who has ever had a baby or known anybody who's had a baby, you know that basically at the 60-day mark, you are still very much in the postpartum period. And in Utah, quite honestly, Utah's maternal deaths primarily occur in the postpartum period, and they are mental health issues and suicides. And sad but true, I'm going to just put a little parentheses here. Murder of women who are pregnant is becoming one of the leading causes of death in our country for women in this age group. So it is really, really appalling. But back to policy. So I've been working with the Utah Health Policy Project, Voices for Utah Children. And what we are trying to do is have a very streamlined process so that when a woman becomes pregnant and chooses to continue her pregnancy, that we have a streamlined process for that, for the delivery and extended care after delivery, and make it all streamlined. Because one thing that's interesting, and many people don't understand this, is if you do not have employer-based insurance, becoming pregnant is not a life-changing event that allows you to get on the private healthcare market. So divorce is, marriage is, but becoming pregnant is not. And so if a woman is not on private insurance, she's pretty much up a creek for this. So we wanted to try to work just as with Senator Kitchens in his contraception bill to expand Medicaid to essentially cover women who otherwise would have been able to receive a subsidy on the exchange. So I am going to leverage Utah embracing there being a pro-family state. All of us know that messaging is key, and we care about women receiving early prenatal care, and that's very, very important. And so our message is going to be, we care about the families in our state, and we care about providing them appropriate care. So that's it. And then as an aside, I am going to, once again, for the last 40 years, people have been trying, various legislators and governors have tried to finally remove the sales tax on groceries. And I am going to take another swing at this myself. So with my colleagues. So myself is not true. It's going to take all of us to make this happen. But those are two initiatives that I have in the space of not only healthcare, but all of us know healthcare also involves food security as well.
Part of health. Thank you, Dr. Lesser. Your voice is so important.
I was just going to mention just one other little thing. Well, it's not a little thing because it's a real concern of mine, is that if we get to a state in Utah that in which medical abortion is going to be one of our only options, I truly, truly fear for the health of our patients. Not so much directed medical abortion care, but I really am concerned about kind of the black market and women taking medication, not the right dose, not really having access to care until they are, profoundly anemic. Annabelle, you had talked about miscarriage care and so forth. And I just wanted a short little story. When I went to Haiti after the earthquake, I was with the medical team that Notre Dame had provided, and we were right next to Doctors Without Borders, and people were walking down the streets carrying pharmacies on their head. They had hats that had medication taped all around it, including medical abortion medication. And people would receive this from the individual who would sell it to them from their hat. They weren't doctors, of course, and patients would take it. And they would arrive at our clinic in shock from hemorrhage. And what we had to do, and this is what happens in third world countries, is we had no blood bank. And to save people's lives, we had to put out our own arms, and everybody who was O negative basically would directly transfuse those women. This happened in the 21st century in a country that's only 90 miles away from the United States. And I just hate to think about that happening in our country too. So that's my 2 cents worth. The last time I was with you, I was so bummed after redistricting. and now this discussion, I think we need Robin to give us some uplifting words because she's always so good for that. But this is really a crisis and we have to step forward. So thank you for listening to my story. It profoundly changed me, and I hope that it will help you fight this fight with us.
Robin, do you mind if I share a quick story?
Sure.
When Rosemary Lesser joined the legislative body, we had a women's meeting where only the women legislators get together. And we had a medical emergency on the floor, and Suzanne Harrison, who's a medical doctor, helped. And so, we were all like, oh, thank you, Suzanne. Thank you, Suzanne. And so, then Rosemary introduces herself as a gynecological obstetrician, women's health, reproductive. And we're like, oh, it's so great to hear you. And she makes like a little joke and says, well, if anybody has a women's health emergency, I'm here for you. And so we all chuckled because that's kind of funny because we're all women. And the Republicans in the room were horrified that she was mentioning some kind of women's reproductive emergency that someone might have. I mean, this is what we're up against. And I laugh at the story, but in the same regard, this is what we're up against, because these women could not even see that this is really a serious situation that people live through all the time. And, Rosemary being wonderful and, just trying to fit in, they couldn't even see like how important it is to have that there. And they couldn't, as females, get together and understand that we do have different needs than men. So it's not just the women in our legislative body. It's not just the men, it's the women as well who don't see this as a real concern. So thank you, Rosemary, for all you're doing. And thank you for letting me interject that story, Robin.
Perfect. Annabelle, do you have any closing remarks there?
Closing remarks. We know we have a lot of work to do. We know we are the right people to do it. What Senator Reeby just said. I mean, have you looked at the book banning list that they're circulating, and where they basically any scene that has anything to do with sex is hot button? They're trying to get books with sex, rape, things, incest out of schools. And it's really speaks to that intolerance for these kinds of important conversations. I think on the positive, Representative Spackman-Moss had a lot of conversations about her consent bill last year, and it failed by 8 votes on the floor after she really amended it a lot. But I do want to say that as hard as they are, and also Representative Romero has been able to have conversations in her bills talking about affirmative consent. So we know it can happen, and we know they're all parents, and they're all, right? All of these legislators have families, people they're concerned about in their lives who face these hard issues. And when we lead with our values, we, as difficult and awkward as it can be, I think we can have conversations. And I'll turn it back to Robin for the cheer.
Okay. Hey, thank you, everybody. That was just fabulous. I learned so much. Our speakers were so informative. I want to do a special shout out to the men who joined us today. Thank you for being there, and thank you for being our allies. I also want to recognize that Representative Lesser did join us. Also, Representative Claire Collard was with us for a while. And we have Diane Lewis, who is the chair of the Utah Democratic Party. So thank you for joining us. And Carrie Galloway, I am one of those 60s women who are just pissed. I just want to tell you that. I am one of those women. Okay, the next meeting of the Women's Democratic Club is going to be on January 15th. I want everybody to take yourself off mute. This is our chance. Take yourself off mute. This is the cheer. All right. I'm going to say until then, well, wait 1 second. Representative Lesser, one of my favorite poets, said, perhaps this is not the darkness of the tomb. No, perhaps this is not the doom of the tomb, but the darkness of the womb. Think about that. Maybe this is the darkness of the womb. And I'm going to say until then, and I want every single one of you to say, keep pushing, okay? Until then.
Keep pushing.
Deliver that.
Keep pushing.
Okay, one more time. Until then.
Keep pushing.
All right. Say happy holidays to somebody. We'll see you in January.
Happy
Thank you all.
holidays.
Happy holidays.
Thank you.
Good